Welcome back to Men's Health 365. Today, we're tackling a controversial topic that generates massive online discussion every November, but is rarely addressed with actual scientific evidence. No Nut November, the Internet Challenge, where men abstain from ejaculation for an entire month, has spawned countless claims about benefits and risks. Some people claim it boosts testosterone, increases energy, and provides mental clarity. Others warn it causes prostate problems and health risks. But what does the actual medical research say? Today, I'm going to debunk 5 major myths about sexual abstinence that even many doctors don't fully understand, using peer-reviewed research from urology, endocrinology, and sexual medicine journals. Whether you're considering participating in this challenge, or you're just curious about how ejaculation frequency affects male health, you need to hear what the science actually shows. Before we dive into the 5 myths and the surprising truth behind each one, hit that subscribe button right now. We're committed to bringing you honest, research-based information about men's sexual health topics that most channels avoid or get completely wrong. Let me tell you about Marcus Chen, a 48-year-old software developer from Seattle who decided to try extended abstinence based on online claims that it would boost his testosterone and energy levels. Marcus had been feeling somewhat low energy and thought maybe his regular sexual activity was depleting him. He committed to 60 days of complete abstinence from ejaculation, both from partnered sex and masturbation. He expected to feel increasingly energized and focused. Instead, after about 3 weeks, Marcus started experiencing uncomfortable pelvic pressure and aching. His sleep became disrupted with frequent spontaneous erections. He felt increasingly irritable and anxious rather than calm and focused. By week 5, he was experiencing what he described as constant sexual distraction, the opposite of the mental clarity he'd been promised. Marcus finally consulted a urologist who explained the actual research on ejaculation frequency and male health. The doctor told him that the online claims about abstinence benefits were largely mythology not supported by scientific evidence, and that regular ejaculation actually has documented health benefits, particularly for prostate health. Marcus ended his abstinence experiment and returned to his normal pattern of ejaculating 2 to 3 times per week. Within days, the pelvic discomfort resolved, his sleep improved, and he actually felt better than during the abstinence period. He realized he'd been following internet mythology rather than medical science. Today I'm going to give you the actual science so you can make informed decisions rather than following myths. Let's start with myth number 1. Abstaining from ejaculation significantly boosts testosterone levels. This is probably the most widespread claim about No Nut November and abstinence challenges. Proponents claim that ejaculation depletes testosterone and that abstaining allows levels to build up dramatically, leading to increased energy, muscle growth, aggression, and male characteristics. So what does the research actually show? A frequently cited study from 2003 published in the Journal of Zhejiang University Science found that testosterone levels increased by approximately 45% on the 7th day of abstinence, then returned to baseline. This study is constantly referenced online as proof that abstinence boosts testosterone. But here's what people don't mention. First, the study involved only 28 men, a very small sample size. Second, the testosterone increase was temporary, peaking at day 7, then returning to normal even with continued abstinence. Third, numerous larger and more rigorous studies have failed to replicate this finding, or have found no significant testosterone changes with abstinence. Research published in the Archives of Sexual Behavior examined testosterone levels in men practicing various frequencies of sexual activity and found no significant differences in baseline testosterone between men who ejaculated frequently versus those who abstained. A study in the Journal of Andrology found that testosterone levels fluctuate normally throughout the day and week, regardless of ejaculation frequency, with circadian and weekly rhythms that dwarf any effect of sexual activity. The largest study, published in the European Journal of Endocrinology, followed over 2,000 men and found that sexual activity frequency was not significantly associated with testosterone levels. Here's what actually affects testosterone levels based on solid research. Sleep quality and duration, with 7 to 8 hours producing optimal levels. Resistance training and exercise, particularly compound movements like squats and deadlifts. Body composition, as excess body fat contains aromatase enzyme that converts testosterone to estrogen. Stress levels, with chronic stress elevating cortisol that suppresses testosterone. Nutrition, particularly adequate protein, healthy fats, and micronutrients like zinc, magnesium, and vitamin D. Age, with natural decline of about 1% per year after age 30. Medical conditions including diabetes, obesity, and hormonal disorders. Notice that ejaculation frequency isn't on this list. The idea that you're losing significant testosterone through ejaculation is biologically implausible. Semen contains trace amounts of testosterone, roughly 2 to 3 nanograms per milliliter. A typical ejaculation is 2 to 5 milliliters, containing about 4 to 15 nanograms of testosterone total. Your body produces approximately 7 milligrams or 7 million nanograms of testosterone daily. You're ejaculating about 0.002% of daily testosterone production. This is physiologically insignificant. The truth is that testosterone levels in healthy men are primarily determined by testicular production, which is regulated by luteinizing hormone from the pituitary gland, not by ejaculation frequency. If you want to actually increase your testosterone, focus on the factors I mentioned: sleep, exercise, body composition, stress management, and nutrition. Abstaining from ejaculation for a month isn't going to meaningfully change your testosterone, despite what internet forums claim. Myth number 2, abstinence dramatically increases energy and focus. This claim suggests that ejaculation depletes vital energy or life force, and that abstaining allows this energy to build up, resulting in increased physical energy, mental clarity, laser focus, and productivity. Some versions invoke ancient concepts like chi or prana being lost through ejaculation. What does science say? There's no research supporting the idea that ejaculation depletes energy in any measurable way. The caloric cost of sexual activity, including ejaculation, is minimal, approximately 3 to 4 calories per minute, about the same as walking slowly. A typical sexual encounter burns perhaps 25 to 50 calories total, less than a small apple. From a purely physiological energy perspective, this is negligible. Regarding mental focus and clarity, research published in the journal Hormones and Behavior examined cognitive function in relation to sexual activity and found no impairment from regular ejaculation. In fact, sexual activity was associated with reduced stress and anxiety, which actually supports better cognitive function. A study in the Archives of Sexual Behavior examined the relationship between sexual activity frequency and various measures of psychological well-being, and found that people with regular sexual activity reported better mood, less stress, and better overall psychological health compared to those with infrequent or no sexual activity. The proposed mechanism is that sexual activity and orgasm trigger the release of endorphins, oxytocin, and other neurochemicals that reduce stress and promote well-being. Here's what likely explains the anecdotal reports of some men feeling more focused during abstinence. First, placebo effect. If you believe abstaining will give you energy and focus, you may perceive these benefits regardless of physiological reality. Placebo effects are real and can produce genuine subjective improvements. Second, reduction in compulsive behavior. Some men spend excessive time on pornography and masturbation, sometimes hours per day in problematic cases. If you're spending 3 hours daily watching pornography, then yes, stopping that behavior will free up 3 hours and reduce the shame or anxiety associated with compulsive behavior. But this isn't because ejaculation depletes energy. It's because you've stopped a time-consuming compulsive behavior. Third, improved sleep in some cases. Men with very high ejaculation frequency, perhaps multiple times daily, might experience slightly disrupted sleep patterns. Normalizing to more moderate frequency could improve sleep quality. Fourth, psychological benefits from self-discipline. Setting a goal and successfully achieving it can boost confidence and self-efficacy, which might feel like increased energy and focus. This has nothing to do with the physiological effects of abstinence and everything to do with the psychological benefits of accomplishing a challenge. The truth is that for most men, moderate regular ejaculation doesn't deplete energy or impair focus. If you're experiencing low energy or poor focus, address the actual causes, which include poor sleep quality or insufficient sleep, inadequate nutrition or caloric intake, lack of physical exercise, chronic stress or anxiety, depression or other mental health conditions, medical issues like thyroid problems or anemia, and excessive alcohol or substance use. Abstaining from ejaculation for 30 days won't fix these problems. Myth number 3, abstinence is beneficial for prostate health. Some proponents of abstinence claim that frequent ejaculation stresses or harms the prostate, and that giving it a rest through abstinence promotes prostate health. This is exactly backwards from what research shows. Multiple large studies have found that frequent ejaculation is associated with reduced prostate cancer risk, not increased risk. The most famous study, published in JAMA by Harvard researchers, followed nearly 32,000 men for 18 years. The study found that men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. This protective effect was strongest for preventing aggressive, clinically significant prostate cancers. The researchers theorized that frequent ejaculation may help clear the prostate of potentially carcinogenic secretions and reduce inflammation. A follow-up study published in European Urology confirmed these findings in an independent population. Other research has found that regular ejaculation helps maintain healthy prostate function, reduces pelvic congestion that can cause discomfort, and may reduce chronic prostatitis symptoms in some men. Research in the journal Prostate examined the relationship between ejaculation frequency and prostatitis symptoms, finding that men with chronic pelvic pain syndrome often improved with regular ejaculation combined with pelvic floor physical therapy. The biological mechanism makes sense. The prostate continuously produces seminal fluid that mixes with sperm during ejaculation. Regular ejaculation clears this fluid, preventing accumulation and stagnation. Prolonged abstinence allows prostatic secretions to accumulate, which may contribute to pelvic discomfort, increased inflammation, and potentially higher cancer risk over many years. Think of it like oil in a car engine. Regular use and circulation keeps things flowing smoothly. Letting it sit stagnant for long periods isn't beneficial. Now, this doesn't mean you need to ejaculate 21 times per month to be healthy. The research shows a dose-response relationship with higher frequencies associated with lower risk, but even moderate frequencies like 8 to 12 times per month appear beneficial compared to very low frequencies. The point is that abstinence isn't doing your prostate any favors. If anything, regular moderate ejaculation supports prostate health. Myth number 4. Abstinence significantly improves sexual performance and function. Some claim that abstaining for extended periods makes you more potent, increases sperm quality, or dramatically improves erectile function. What's the reality? Regarding sperm quality, research shows a complex relationship. Very frequent ejaculation, multiple times daily, can temporarily reduce sperm count per ejaculation, simply because you're not allowing time for sperm reserves to replenish. However, prolonged abstinence doesn't continuously improve sperm quality. Research published in Fertility and Sterility found that sperm quality actually peaks with 1 to 2 days of abstinence, then begins to decline with longer abstinence periods. After about 7 to 10 days of abstinence, sperm motility and morphology actually worsen due to aging sperm cells. The World Health Organization recommendations for semen analysis specify 2 to 7 days of abstinence before sample collection, as this range produces the most accurate representation of normal sperm parameters. Very long abstinence periods result in higher sperm count, but lower quality in terms of motility and morphology. Regarding erectile function, research published in the American Journal of Medicine found that regular sexual activity is associated with maintained erectile function as men age, while prolonged periods of sexual inactivity are associated with increased erectile dysfunction risk. The mechanism involves regular erections, maintaining healthy penile tissue through oxygenation and blood flow. The saying, "use it or lose it," has biological truth for erectile function. Research shows that regular erections, whether from sexual activity or spontaneous nighttime erections, keep the smooth muscle tissue in the penis healthy and prevent fibrosis or scar tissue formation. Men who go long periods without any erections, for example, after nerve-damaging prostate surgery, often develop penile tissue changes that impair future erectile function. This is why urologists often prescribe medications or recommend regular stimulation to promote erections during recovery periods. For healthy men, normal sexual activity maintains tissue health, while prolonged abstinence provides no benefit and may actually allow some degree of tissue deconditioning. Regarding sexual performance in terms of stamina or lasting longer, abstinence might increase ejaculatory latency time simply because you have more built-up physical response, but this isn't necessarily positive. Many men who abstain for extended periods report difficulty controlling ejaculation when they resume sexual activity, experiencing very rapid ejaculation from heightened sensitivity and arousal. This resolves after returning to more regular patterns. The truth is that moderate, regular sexual activity maintains optimal sexual function. There's no evidence that monthly abstinence challenges improved sexual performance. If you're experiencing erectile difficulties, premature ejaculation, or other sexual function problems, address them through appropriate medical evaluation, pelvic floor exercises, behavioral techniques, psychological support if needed, and lifestyle improvements, including cardiovascular exercise, healthy diet, stress management, and adequate sleep. Myth number 5. Abstinence has no negative effects, and everyone should try it. Proponents often present abstinence as risk-free with only potential benefits. But is this accurate? For many men, extended abstinence can produce unwanted effects. Research published in the Journal of Sexual Medicine identified several issues associated with prolonged sexual abstinence, including increased pelvic congestion and discomfort, particularly in men with existing prostate conditions, sleep disruption from frequent spontaneous erections and nocturnal emissions, increased psychological tension, irritability, and anxiety in some individuals, potential relationship strain if one partner desires sexual activity and the other is abstaining, and increased sexual preoccupation and distraction, the opposite of the claimed focus benefits. Marcus Chen, the software developer I mentioned, experienced several of these effects during his 60-day abstinence attempt. The pelvic pressure and aching he described is common and occurs because the prostate and seminal vesicles become engorged with accumulated secretions. His sleep disruption from frequent spontaneous erections is a normal physiological response to buildup of sexual tension. His increased irritability is consistent with research showing that sexual activity helps regulate mood through neurochemical mechanisms. Furthermore, for men in relationships, unilateral decisions to abstain from partnered sexual activity can create tension and hurt feelings. Sexual intimacy is an important component of romantic relationships for most couples. Withdrawing from this without discussion and mutual agreement can be damaging. Research on relationship satisfaction consistently shows that couples with mutually satisfying sexual relationships report higher overall relationship satisfaction, while sexual disconnection is associated with relationship problems. Additionally, men with a history of problematic pornography use or compulsive sexual behavior need to be careful about abstinence approaches. While reducing compulsive behaviors is beneficial, strict abstinence rules can sometimes create shame and increase risk of binge relapse cycles. Research on addiction and compulsive behaviors shows that approaches emphasizing moderation and healthy patterns are often more successful long-term than strict abstinence rules that set up all or nothing thinking. The truth is that abstinence isn't inherently harmful for short periods for most men, but it's also not inherently beneficial, and for some men it produces unwanted physical and psychological effects. The idea that everyone should try month-long abstinence challenges isn't supported by medical evidence. What is supported by research is the benefit of moderate, regular sexual activity and ejaculation for physical health, psychological well-being, relationship satisfaction, and quality of life. So what's the evidence-based approach to ejaculation frequency? Research suggests that 2 to 4 times per week appears optimal for most men, correlating with health benefits, including reduced prostate cancer risk and maintained sexual function, psychological well-being, including stress reduction and mood regulation, and relationship satisfaction for partnered men. However, individual variation is normal and healthy. Some men have higher or lower natural drive, and any frequency that feels comfortable and doesn't interfere with daily functioning or relationships is fine. What you should be concerned about is compulsive sexual behavior that interferes with daily life, work, or relationships, excessive pornography use, particularly if it's progressing to more extreme content or causing distress, sexual activity that harms yourself or others, and erectile difficulties or other sexual function problems that cause distress. These issues warrant professional help from therapists specializing in sexual health, urologists, or other appropriate providers. What you don't need to worry about is whether ejaculating 2 versus 5 times per week is depleting your energy or testosterone, whether you need to periodically abstain to boost performance, or whether normal, moderate sexual activity is harming your prostate or general health. The research clearly shows that moderate regular sexual activity and ejaculation is healthy and beneficial for most men. Let me address the question many are wondering. Should you participate in No Nut November? From a pure medical standpoint, there's no evidence-based health reason to do so. The claimed benefits largely aren't supported by research, and some men experience unwanted effects. However, if you're interested in trying it as a personal challenge to exercise self-discipline, that's fine. Self-discipline and the ability to control impulses are valuable skills. Just go in with realistic expectations based on science rather than internet mythology. If you decide to try it, be aware of potential unwanted effects like pelvic discomfort, which typically resolves if you discontinue the challenge sleep disruption from spontaneous erections, increased irritability or anxiety for some individuals, and potential relationship impacts if you're partnered. And don't expect miracle transformations in testosterone, energy, or performance that aren't supported by research. If you're considering abstinence because you're concerned about compulsive sexual behavior or problematic pornography use, month-long abstinence challenges probably aren't the most effective approach. Research supports structured behavioral therapy, cognitive behavioral therapy for compulsive behaviors, mindfulness practices, lifestyle improvements, including exercise, stress management, and meaningful activities, and professional support from therapists specializing in these issues. If you're hoping to boost testosterone, focus on evidence-based approaches, including 7 to 8 hours of quality sleep per night, regular resistance training 2 to 3 times per week, maintaining healthy body weight and reducing excess body fat, stress management through meditation, exercise, or other techniques, adequate nutrition, including protein, healthy fats, and key micronutrients, and addressing any underlying medical conditions. If you want to improve sexual function, focus on cardiovascular exercise to improve blood flow, pelvic floor exercises to strengthen supporting muscles, maintaining regular sexual activity to keep tissues healthy, addressing performance anxiety through therapy if needed, and ensuring good overall health through diet, exercise, sleep, and stress management. Before we wrap up, I want to emphasize that sexual health is an important component of overall health and quality of life. Making decisions based on accurate information rather than internet mythology is crucial. The 5 myths we've debunked today: that abstinence significantly boosts testosterone, that it dramatically increases energy and focus, that it benefits prostate health, that it improves sexual performance, and that it has no negative effects and everyone should try it, are all contradicted by actual scientific research. The reality is that moderate, regular sexual activity and ejaculation is healthy and beneficial for most men. It supports prostate health, maintains sexual function, contributes to psychological well-being, and enhances relationship satisfaction. You don't need to participate in abstinence challenges to be healthy. Focus on evidence-based approaches to optimizing your health, testosterone, sexual function, and overall well-being. Marcus Chen, after his disappointing abstinence experiment, returned to his normal pattern of 2 to 3 ejaculations per week. He focused instead on evidence-based health improvements, including better sleep, regular resistance training, improved nutrition, and stress management. His energy levels improved far more from these changes than they ever did during abstinence. He learned that following science rather than internet trends produces better results. Now I want to hear from you. Drop a comment below letting us know what country you're watching from and whether you've tried abstinence challenges and what your experience was. And please hit that subscribe button. We're committed to bringing you honest, research-based information about men's sexual health, cutting through the mythology, and giving you the facts. By subscribing and sharing, you help us reach more men who need accurate information rather than internet myths. Remember, your sexual health is important, and decisions should be based on science and your individual circumstances, not on trendy challenges or unsubstantiated claims. Moderate, regular sexual activity is healthy. Don't let internet mythology convince you otherwise.